Hello, my name is Jay Ballard, and today we're going to have a speech and a little 5-minute talk about a very sensitive subject to some, and it's honestly about nursing, especially Sane Nurses, which is a sexual assault nurse examiner, and it deals with a nurse's role as well as a healthcare system's role following a sexual assault survivor. And when most people think about nursing or emergency services, you picture trauma alerts, you picture codes, cardiac arrests, critically ill patients, and those situations absolutely define emergency medicine and emergency rooms, but they're not the only moments that change a person's life. Now, sometimes someone could be sitting quietly in a private room and experiencing one of the, they it could appear just not injured, they could appear just perfectly fine, just sitting there, but they could also be experiencing one of the worst days they will ever face. Imagine you or a family member, friend, a brother, sister, a husband, wife, grandma, grandpa, just the survivor of a sexual assault and just walks into the emergency department, frightened, overwhelmed. It could have happened earlier today. It could have happened a couple days ago. They could have not slept. Um, People often experience how unsure on how to explain what happened and understand who they can trust, what they can do. And now, we as like in these cases of adult sexual assault survivors in the ER, like it does something called trauma informed nursing care affect how these response and how these nurses and healthcare system how they can affect the survivors' well-being and future care. And yeah, at first it sounds like a racist question, but it's asked something more important than that. Now, how can we care for someone during these few hours in the emergency department, and how does that affect how they can recover over the next months, years, weeks, days? And according to a lot of evidence, these special practices called trauma-informed care practices and protocols, they can. O'Doherty et al. And Piran et al. 2024 and Roberts et al. In 2025 all conducted studies showing consistent support of trauma-informed care as effective framework for imposing experiences and psychological outcomes of survivors following these sexual assaults. When you review those, one thing I found interesting was how consistent the findings were, regardless of what country the research was in, regardless of who was conducted on male, female, adults, children. All the survivors described many of the same needs. They wanted healthcare professionals who listened, not judged. They wanted privacy. They wanted clear explanations before the procedures. They all wanted to feel involved with the decisions about their care, and they wanted someone to actually believe them. Those findings were repeated across multiple qualitative studies where survivors consistently described respectful communication, emotional validations, shared decision making, and some of the most meaningful parts of the healthcare experience in those emergency room visits with those trauma informed care, those sane nurses. That's with Amween et al. 2021, Meyer et al. 2025, and Piran et al. 2024. And what stood out to me was that these interventions are not technically difficult. They do not require extra equipment. They do not require additional medications. They just require us to be intentional with how we interact with another human being. Um, they research by O'Doherty and Roberts, 2023 and 2025, showed that the TIC, the trauma informed care, associated with reductions in anxiety, reduces depression, the symptoms of post traumatic stress, while improving the trust in the healthcare providers and increasing engagement and follow up care. And as nurses, they a lot of them focus on measurable outcomes, vital signs, clinical procedures, pain scores, lab values, um, and those are important, but they're not important to everyone. Some things are more important. Maybe a secluded room is more important. Whether someone respected them is more important. Whether someone just explained what is going on, like, why are you here? What is going on? What is the next step? Where can we go from here? And giving them choices of the next steps. They are someone who just had choices ripped away from them. The least someone can do is offer them a choice. And that made me stop and think of how can we underestimate this? The impact of a single conversation. Why do most people pass this up? They underestimate it. They just blow it off. Instead of asking, hey, what's wrong with this patient? We can ask why and what happened. Get the backstory. Not, oh, they were injured. Oh, they were hurt. Oh, it was a domestic. No, what is this person doing there? How can we help them? What happened? And that small change affects every interaction we have with them. We can, how we explain procedures, how we can ask for consent, how we preserve their patient privacy, even if it's just, or their non privacy. Maybe they just want to sit with someone. Maybe they just want to sit in a dark room for 20 minutes, an hour, 2 hours, 5 hours, and just sit there with someone to make them feel safe. And on top of that, we're getting into these aspects. We're getting into what if here, what if there, and that just shows you. And our literature and reviews show us that no two individuals, no two survivors are alike. Each culture, each race, ethnicity, gender identity, previous healthcare experiences, even personal beliefs and religions all shape that person and how they respond to traumatic events. And providing this trauma informed care and practices means recognizing those differences, altering your approach, and practicing cultural humility rather than assumptions. Walsh 2024. Now, one thing becomes very clear throughout researching this topic and study that trauma informed care is not a nursing protocol. It's not a thing. It's evidence-based care. It's an evidence-based approach. It has been researched time and time again to make someone feel safe, respected, and empowered during one of the most vulnerable moments of their life. Now, the emergency department may not only care for a survivor for a few hours, but those few hours may impact the rest of their interactions, possibly for the rest of their life. Gross et al. 2020 and Roberts et al. 2025. And as nurses, we may never know how the story ends. We may never see him again, or we may see him all the time, but we don't know what happens after they leave the door. But the evidence suggests that the way we communicate, the respect we demonstrate, and the compassion that we can provide can influence whether recovery begins with fear and apprehension or trust and respect. To me, that's one of the greatest responsibilities we have as care providers. Every patient interaction is the opportunity. Sometimes that opportunity is saving the life. And some of those opportunities, it's saving the life in a manner that you didn't even think possible. Because that one conversation you had with them, that one respect you gave them, those choices you given him may have been the difference between getting discharged and seeking additional care and services or getting discharged, going through depression and contemplating suicide. And while these moments may not only take a few minutes during our shift, our lives, they may become the most memorable moments of our patients' lives for the rest of their care, the rest of their memory, and could shape their view on healthcare in days to come. And we're going to just share some quick references here. And maybe not. I'm going to share our references here with Arwin et al., Anderson, Gross, Mayer, McLeod, O'Doherty, Piran, Roberts, Tuga, and Walsh. Thank you for your time.